Welcome to the Franklin Method Fellowship. I'm your co-host Solange Ross, and I'm joined by my colleague Deborah Chassie. We are physical therapists specializing in the pelvic floor. In this podcast, we share our passion for the Franklin Method, an evidence-based therapeutic approach using mental imagery, movement, and awareness to improve posture, the way you move and feel, and overall well-being. We integrate the Franklin Method into functional everyday movements, all forms of exercise, and our physical therapy practices. We also share a love for talking about the pelvic floor. We hope to inspire you to move better and feel better in your body. Always check with your doctor before beginning an exercise program. This podcast is not intended to be used as medical advice. Let's grab your Franklin Method balls and bands. Enjoy the show.
Hello, everyone, and welcome to the Franklin Method Fellowship. I'm Deborah Chassie, and I'm here with my colleague, Solange Ross. And today, we are doing episode 16 on post-surgical shoulder surgery. And so we're really happy to have you joining us for this.
I'm really excited about this episode because I think probably everyone that's listening knows someone who has had a shoulder surgery or maybe has had a shoulder surgery themselves. So it's kind of something that touches all of us.
And what's interesting is I have a sister who had shoulder surgery about a year ago. And this week, my other sister and my brother are also having shoulder surgery. So this is perfect timing.
Yeah, and I'm just thinking about my dad who he doesn't ski anymore, but he loved to ski. And I think 3 times he broke his collarbone during a fall.
Oh, no.
And I think he had it a repair the last time. So yeah, we, and my mother-in-law had a shoulder surgery. So, it's certainly very, very common. And I'm excited to get into it today.
Yeah, great. So the goals that we want to bring forward are, it's important to get early intervention. So that's really what we're going to be doing today, is talking about what you can do for early intervention and at the beginning of your healing process. So there's going to be some contraindications that will be given to you by your doctor, precautions and things like that. So you definitely want to adhere to all of those, and you want to make sure whatever you're doing is in a comfortable range. And secondly, our goal is to help you feel more comfortable. And we're going to use posture and breathing to help you be more comfortable following your shoulder surgery. And we want you to be able to get the most out of your exercises. So you'll be starting physical therapy soon after your surgery. And how can you get the most out of your exercises? And lastly, we want to help support you in increasing proprioception and increasing circulation. And this will help the body heal as you're recovering from your surgery.
So our bodies are not designed to be sedentary, but sometimes when we have an injury or a surgery, we have to keep that part immobilized during the healing process. But that doesn't mean that we can't move other parts around it. And we want to keep our body as a whole moving so that as the structures in the shoulder are healing, our back, our legs, our head and neck, our feet, our body as a whole system is not stiffening up as well. So when you do these movements, if you feel any discomfort right away, we want you to stop what you're doing. So always respect what you're feeling in your body. And if there's something that you're not sure of, you can always just watch and imagine that you are doing the movement. And in Franklin Method, we call that mental simulation of movement, MSM, or motor imagery. And what that is we can imagine a movement. So whatever brings you discomfort, you can imagine it. And what that does is that stimulates a small percentage of nerve fibers. So you're still making the connection between your brain and your body, even if you're not moving. So that can be an important tool for you as you're healing.
Excellent.
Yeah. So to begin with, getting you more comfortable, we're going to begin with posture. So if you have your Franklin method balls, you'll get the balls, and we're going to place them under our sitting bones. So if you're not able to use your balls, so if it's very early on in your recovery, I have a rolled up bath towel. Deborah has a rolled up washcloth. You can
Hand towel.
Hand towel.
Yeah.
So you can use whatever you have, and then place that on your seat.
And of course, they're going to place it with one hand.
And then you can use that as something just to give you the input as you're rocking forward and back. And even if you don't have the towel with you, wherever you are at that moment, it's fine for you to just be in your seat and just rock back and forth with us. You can imagine that you're sitting on a towel. Mm-hmm. We're just going to begin by moving our pelvis. So we're going to rock our pelvis back and then rocking our pelvis forward. And we can think about, as an image to help us, our pelvis being a bucket of water. And when we rock back, that bucket of water would tip back on us. And when we rock forward, it would spill forward onto the floor. So
I'm using my hands to demonstrate, filling it up right here and dumping it out.
So you'll rock back and forth a few times. And now let's take the awareness to our spine. So can you notice as you're moving the pelvis back and forth that your spine is rounding and then arching? And keeping your awareness in your spine, also notice what's happening with your head and neck. So as you round your spine, do you feel your chin dropping a little bit and your head dropping down? And as you arch, your chin lifting up. And then we'll come to a position where we're just sitting on the balls. And here we'll now just move our neck. So just drop the chin to the chest. And then let your head look up towards the ceiling. And remember to do what's comfortable for you.
And working with the neck post-surgery is really important. Many of you are wearing a sling, and the neck gets tired holding up the shoulder with the sling.
We can also let the ear drop towards the shoulder, going into a side bend. And make sure that you move slowly, especially as you bend away with your head from the side that you've had the surgery. You may feel something. So if there's a sensation that's maybe too much of a stretch, then just back off. And let's now take our head into a gentle circle. So moving slowly. taking the time. And it's really good to keep the head and neck moving because you're moving your head and neck around all day long, when you interact with the world. So to do this in good sitting posture and to give the muscles a time to be mobilized and stretched. And then let's look over one shoulder. And as you're moving, check in and make sure that you're breathing. And then let's take the balls away. And notice our sitting posture.
Easier to sit, isn't it?
It feels nice and supported. And, we talked about having the sling on and wearing the sling and that tending to pull on the neck and to feel like the shoulder and the arm is being supported by the neck muscles and the neck muscles fatiguing. Well, this is a great way to feel support from way down from the pelvis. So if we can embody that support from the pelvis, then we can take unnecessary tension out of the neck and shoulders.
Absolutely.
And we'll notice our breathing.
It does make breathing easier, doesn't it?
Definitely. And place one hand on your chest. Take a breath in. And lower your hand now and place it on your belly. And we want to make sure that when we're breathing, we can sense that gentle rise and fall of the belly. And when we have our hands on our chest, we can feel that gentle sensation of our ribs moving into our hands. And with our breathing, especially when we're healing and we're not moving a certain area, and perhaps we're getting some compression with posture as well, we can get a lack of space in the shoulder and across the chest. Mm-hmm. So let's use this image. In Franklin Method, we have an exercise where we place our balls in our armpits. And we imagine that our shoulders are just melting over the Franklin balls. But we'll imagine that we have a balloon in our armpit. So can we take balloons and put them in our armpit, whichever side that we've had our surgery on? And then we can take our hand and place it whatever feels comfortable. Maybe you can get your fingers into your armpit. Maybe you're just on the front of the chest. And as you imagine that you have this balloon in your armpit supporting your shoulder, let's take a breath in and feel your chest expanding into your fingers, in the sense that where your fingers are, that would be pushing into our imaginary balloon.
I can even feel my breath pushing my ribs into my hand.
Mm. And if you can imagine your ribs when you take a breath in, Can you imagine that the spaces in between the ribs are just gently fanning open or yawning open? That when you take a breath in, there's a big yawn or a sigh in between those rib spaces. And then you can take your hand away. And
Know the difference between the two sides?
Yeah. And just notice how that sense of support, how that perhaps may feel different than your neck muscles are holding up your shoulder. The idea that there's this nice balloon supporting your shoulder, that your shoulder can just drape over this supportive balloon, and that you have your breathing to help with that support as well. And we can, of course, do that image with the other side. Because now maybe your surgical side may feel better than your good side. And
What I'm noticing.
yeah, and the good side is going to need some work and some TLC, because that's the part that's, taking over, and compensating and helping out. So we want to make sure that you do some mobility and like you keep your good side so that it's not just getting overworked, that we give it the same image on this side.
So let's imagine that we have a balloon on our opposite side, the side that was not operated on. And using the same image, imagine a balloon is filling up the space, and imagine being able to feel the pressure against your ribs. So you won't be able to use your operated arm because you can't move it that far yet. But just go ahead and imagine that your fingers or the balloon is placed in your armpit. And let's go ahead and breathe into the balloon. We're taking a breath in and out, and really feel the rib cage on that side being pushed into the balloon. And imagine the rib cage opening, because that's what the intercostal muscles do, right? They lift up the ribs. Or yawning. And then again, pressing into your balloon. I think that image works best for me. The balloon and the rib cage pushing into it as you breathe in. But another image would be an accordion. An accordion opening and closing as you exhale. And I'm going to just demonstrate with my hand the accordion opening at the ribs and exhaling. And again, breathing in and
I was imagining with the accordion, sort of, how like the accordion can like wrap around end to end. So kind of like the accordion just filling out the whole space in my armpit. So that's how I was thinking about that image. I liked that.
Yeah, that's great. So why don't we move on to some other breathing techniques or let's move on to some tapping to help with our breathing. So if we take our non-affected hand and just tap gently above the collarbone, that's going to stimulate the lymphatics. And you could tap all around your chest. And if you can get your hand under your arm a little bit, maybe by side bending, just to give a little space. And your neck. your sternum, create some sound. You know, it's funny is because of my tremors, the tapping is quite spontaneous. Okay. Now, how about some brushing? So the lymphatics flow from the part of your limb that's furthest away, which would be your hand, up the arm, all the way up to the collarbone area, where there's lymph nodes here and also under the arm. So let's actually start by just doing some brushing from the elbow to the shoulder. So just nice, gentle brushing. And just realize that what you're doing is you're really stimulating lymph flow by doing brushing. You could even do little short strokes if you wanted to get lymph to move. Interesting, the lymph vessels that are moving lymph fluid, each vessel is very short. So this little bit of brushing, little strokes, actually help reinforce lymph flow. And then you could even get the back of your arm as best as you can reach it. And maybe you could even come inside with the back of your hand and just bring it up into the armpit. So I'm going to bring my arm away, but I'm doing it like this. Right? So you won't be able to move your arm that much until you've been released to do so. But you can definitely get lymph moving this way. And this is where the majority of the lymph vessels are located too, is on the inside part of the arm. Does that feel good?
I was just thinking that it just feels so kind to my body.
Yeah.
So gentle and kind. And I was thinking just how important that is to get these good sensations for us to notice rather than sensations of pain or aching or stiffness, to introduce this nice, gentle stroking sensation is really good to make a change in our brain.
And then let's move to our wrist, and we're going to do the same thing, going from our wrist to our elbow, and then we could travel all the way back up our arm. So the lower arm is very important too, post-surgical, because you don't want your lower arm to get stiff. You want to keep moving. So again, your arm's going to be in a sling, and maybe you take it out if you feel like you're able to. But you could also take the backside of your fingers and put it on your forearm and bring the fluid up that way too. And I like what Solange is doing. She has a blanket, pillow, towel under her arm, and she's doing the brushing that way. Brushing stimulates proprioceptors. And what that means is you have sensory organs that are under your skin, and that when they get stimulated, they help lymph to move. And breathing helps lymph to move too. So make sure you're always breathing, focused on breathing. If you start to feel any pain, go to your breathing. Okay. And then let's go to our hand. And so with your hand, you can just brush over it. Are your different position here? You brush over your hand. And you could even work with each individual finger as you brush over it. thumb. And you could even do some gentle tapping on your hand and on your forearm. Go gentle. Just make sure it's not vibrating your shoulder, hurting your shoulder. And then go ahead and brush from your hand to the elbow and up the arm. And over to the shoulder. I'll do that several times. And you could do short strokes or long strokes. And notice when I'm doing the brushing that I'm just doing little strokes. And it's kind of like you're going back over part of your stroke. You just reinforce it. And again, if you can get the side of your hand under your forearm, you can again brush all the way up your arm to the armpit. Good. Let's just see how that feels in your posture and your breathing. You feel more at ease. Does your shoulder feel more relaxed? How does your neck feel? That loosen that up a little bit more.
What I really liked about that was really calming.
Mm-hmm. Yeah,
It was
stimulating the lymphatics is very calming.
very different than if you're following along with the podcast when we do like different tapping and shaking where we feel like the arm become like more alive and tingly. It's a different sensation. Like it really just feels like I actually feel like I have a lot of space in my shoulder and it's just like a nice relaxed arm rather than like a tingly and awake and an alive arm. Still alive, but
Well, we definitely want it feeling alive and supported and loved because it's healing.
yeah.
Yeah.
So we're going to do a little bit more for our wrist and hand. So you can take your hand and massage also into your palm on the thumb side and then into the other side of your hand on your pinky side. So giving just a gentle massage of these muscles.
And you have to make sure that you're following your shoulder precautions for how you're doing this with your hand. So you may not be able to rotate it over. You might have to keep it in this position, but you can definitely bring your your fingers over it so that way you're massaging from this position.
And it could feel good to even just have your arm rested on a surface. If you're sitting at a table, to have it rested while you do the massage. And I can certainly appreciate, in my own experience, the connection between the shoulder and the hand and the hand and the shoulder. This was a few years ago, I jammed one of my fingers playing basketball with my son. And not only did I have something in my hand, but then it went up into my forearm and then to my shoulder as well. So having to keep my finger immobilized, while I was still using my arm, I developed some issues in my forearm and shoulder. So taking the time to work on the hand and part of the limb that's, away from the injury can help with the healing process. And then we can also, for our wrist, we can gently flex and extend. And then I like to actually use my good side to kind of help and assist it into flexion.
See how my thumb is pushing the forehand, the hand forward. My thumb is pushing the hand forward, and then my fingers are pulling it back along with my thumb.
And that's just another nice thing to do to get some circulation into the hand, the fingers.
When you're further along in your shoulder rehab, you could look at episode 11 on the shoulder, where we talk about all the joints of the shoulder. So even if you're not ready to actually do those exercises yet, you can watch the episode and notice where we're describing all of the different joints of the shoulder.
And we've got one more thing to help you, because we're not just sitting all day long, right? We're getting up and down and changing different positions, and maybe things feel different for you. Maybe you used to use your arms to push up and you can't use your arm now in the way that you did. So we can use that image of the balloons in the armpits to help us get out of the chair. So when we sit up, and we'll all sit up together, we'll imagine that as we sit up, those balloons are going to lift us up. Shall we try that?
Yeah, absolutely.
So balloons lifting us up. And then the balloons supporting our shoulder as we lower down.
And I'm just putting these balls in here just to help give you the image.
So let's try that again. Our balloons are going to float up and take us up. And lowering us down. And we could also take an image for the pelvis to help us get up. So we can think about, let's try this. Maybe our pelvis is this geyser that's going to spray water up, and that's going to help us rise up while we keep our shoulders relaxed. Maybe they're still relaxed from the balloons. So stand up with that geyser. It's going to gush and lift us up.
Lower us.
Yeah. And can you imagine, maybe it's like this nice fountain that like gently lowers you down. So it's like the fountain sprays up, but then it's like lowering before it shuts off. So stand up. Would you like to try an image, Deborah?
I'm not thinking of one right offhand.
I have another one. This is another classic Franklin image. Our pelvic floor is a magic carpet. So if we think about, we just did this rocking on our sit bones, right? So if in between our sit bones, we have this magic carpet. And what does it do? A magic carpet just like lifts up and takes off. So we're going to get up out of the chair from the magic carpet. And now we're flying in the air, and then have it lower you down. Magic carpet takes you up and lowers you down.
There is an image that I really like, and that is that of a jellyfish. So, when you watch them in the water, they just have this slow flowing movement. And so we could imagine that our pelvis is a jellyfish. And so when a jellyfish moves, if you watch them in the water, they're just so graceful. And so they're moving like this. And so if you imagine that being your pelvis, and as you go to stand up, that the jellyfish is just lifting you up and then gently lowering you. And one more time, jellyfish lifting you up and lowering you. That feels
like
nice
that.
and loving. Yeah, I know. I liked it too. You know what it reminded me of is years ago we were out at Catalina Island and on a boat. So the boat was docked and we were going to go into the city. But we noticed all of a sudden all of these manta rays that were around because there was a blue light shining in the water. So there were just like easily 100 of them just all over the place. So instead of going into town, we got our goggles out and got on the paddle boards and things like that, and then just watched these manta rays in the water. They were just so graceful, just the way they were moving. And so we could even think about the manta ray as it's moving and our shoulders being kind of like a manta ray. So as we're just kind of floating, gliding in the water, checking things out, noticing that beautiful blue light, what's attractive about it. And see how it gives you a nice movement in your spine.
That feels really comforting. I like that.
Kind of floaty, isn't it?
Well, we hope that you've enjoyed these exercises and they've made you feel more comfortable and you feel some nice support in your pelvis, maybe some release sensations in your arms, some relaxation in your neck, and some other nice, good sensations, whatever you feel.
Thank you so much for joining us. And we want you to have a great healing experience. So I like the words happy healing, right? Our body is healing. And always focus on that too. So, when you're feeling discomfort in your arm, you can always say, oh, happy healing for my shoulder. And allow your body to really experience that healing process. And we'd also like you to know that we're going to have a part 2 for shoulder rehab. So that way, when you're in your physical therapy and receiving exercises from them, we're going to give you some images that you can use to help support your healing process.
Great.
Solange, do you have anything to add to that?
Yeah, well, I look forward to that, to us being able to help make your exercises more effective with imagery. And we hope you've enjoyed this episode, and we'll see you next time. Bye.
Bye.
Thank you for joining us. We hope you enjoyed the episode. Please like and subscribe to our YouTube channel, and we would greatly appreciate it if you would leave us a review. You can also become a patron of the podcast. Join our patron program to get access to movement practices from each episode, bonus episodes, and Q&As where we answer any questions you have about the practices. We look forward to practicing with you and continuing to share our passion. As we say in the Franklin method, better information leads to better navigation. Keep practicing, and we'll see you next time.